Welcome to the recording of the Men's Health Seminar, which took place on Thursday the 2nd of July. What's all the fuss? I'm fine. It was held in two sessions, and the session you're about to watch was in the afternoon, themed on individual health. Enjoy. Now, self-management is it's an area that I'm massively passionate about, as I am with mental health anyway, but specifically around self-management. Myself and my old business partner, Amelia, we developed a 3-self strategy based on self-awareness, self-care and self-help. Now, it was developed through my experience of mental illness and post-traumatic stress disorder, turning into complex post-traumatic stress disorder, dealing with generalized anxiety disorder, depression, and how I didn't receive any support at all professionally for the past 4 years. I've only just started receiving therapy from PTSD Resolutions, which is a military charity. So I've only just started gaining that support, and I'm still trying to get, support from adult social services and social care and all these kind of elements still, because I just kept getting referred and re-referred, and I know how frustrating it is, and how frustrating it can be for the partners and family members as well. And so they're the two kind of massive areas for me that I'm really focusing on this year, and definitely moving into next year is around self-management for all, but specifically within men's health and partners and family members. So what is self-management all about? It's basically taking care of yourselves, how we go about it and how we manage ourselves. Now, this isn't meant to be a replacement for professional services. It's being realistic and accepting the fact that pre-COVID-19, the NHS mental health services was stretched. Okay, some may say overstretched. It's starting to get worse now, but give it another month or two, and it's going to be in a really bad way. The government don't appear to be addressing the situation. They don't appear to be investing the billions of pounds that's needed to, instead of put out fires when people are in crisis and interventions, instead of solely doing that, we want to be looking at actually trying to prevent it from happening in the first place. And the only way to do that is through education and empowering individuals themselves. So self-management is all about empowering ourselves and managing our own symptoms, our own emotions, our own thoughts, our mindsets, and to a point where we can get by day to day, but long term we still need that professional support. And as we know, there's long waiting times, and people can go downhill massively during the long waiting times. And with all the insecurities and the uncertainty, the anxieties, the fear, the isolation and loneliness, all these kind of issues are happening now, to everybody. There was Simon Marion from Icarus Online, one of our sponsors, hasn't been able to make it today because he's so busy helping people who are in crisis. There's a couple of other individuals that wanted to be here today, but they couldn't make it. I know there's people who's paid tickets who are HR and wellbeing people within their own organisations, and they've not been able to turn up because they're helping other people who are in a bad way at varying degrees. And this is happening now. And whilst it might not be happening to you, and some people struggle to understand or why people are struggling so much, because if it's not on your radar and actually in your world and how you are mentally and your well-being, things like water off a duck's back, and you know, you kind of manage things really well, and you haven't experienced mental ill health, then it can be really difficult to understand and empathize with these individuals. But the simple fact is, even if you look at people who've got chronic pain, so 28 million adults in the UK struggle with chronic pain every day of their lives. Greater percentage of that is from musculoskeletal back pain problems, as HR individuals at workplaces know. But then we're talking also about fibromyalgia, and stress and trauma can trigger fibromyalgia, can trigger these your nerves to be extremely heightened, which leaves you in a debilitating state with chronic pain, and managing that on a daily basis. And trust me, take it from me, because I've been trying to manage with it, learning how to manage it for the past 8 years or so. And so managing pain when you experience pain, for at least for me, 24 hours a day, 7 days a week, consistently, non-stop, that impacts on your sleep, that impacts on your limitations, what you can and can't do. It's extremely tiring, emotionally and physically, and it absolutely impacts on your mental health. So, you know, there's a figure for you straight off the bat, 28 million people, and that's before COVID-19. So, you know, and again, before COVID-19, 9 million adults in the UK admitted to struggling with isolation and or loneliness. And they're the ones who admitted to it. Obviously, with the stigma, the true figure is so much likely to be so much higher. So this is where self-management really, really, really comes in. And this is why I do the best that I can to really push it out there. I'm putting my courses online at the moment to go through the process and trying to get some funding to make them available for free. We'll see how that goes. So let's begin looking at self-awareness. Self-awareness is the larger of the three, so let's spend a bit of time with self-awareness. When we're talking about self-awareness, we're talking about identifying who you are as an individual. Who are you inside? You know, it's identifying what your values are, what are your beliefs, how do you view life, what are your strengths and weaknesses, what's your purpose, what's your meaning, what's your identity. You know, as a small cog in a massive set of cogs called life, where do we fit within this? Where do I fit within this? What's my identity as an individual? And ultimately, you know, what do I want to leave behind? What do I want people to know me for and as? So if we kind of look at this, and let's look at values first. Values is about living what's important in life. So when I was in the military, my values, well, the values of the British Army were sea drills. So that's courage, discipline, respect, integrity, loyalty, and selfless commitment. Okay, so I lived, slept, breathed, fought those values, and they became very much a part of me and who I am. I then took them across from the military and implemented them into, in fact, both my businesses. And I truly believe that having such values is one of the main reasons why they've been so successful, or at least successful. Maybe not so successful, but at least they've been successful because of the values. So, you know, who are you as an individual, and what is truly important to you? You know, making it about family and having a well-balanced, you know, that could be a value for you. It's not about materialistic things. It's not about something you can buy, but you can certainly seek to achieve and live by the values which are really important to you, because they make up who you are as a person. So we kind of have that, and then we all have our own perceptions in life, don't we? You know, we all view life our own way, and in a certain way. It's very individual to us. And it's really important to understand that, because when it comes to maybe conflict resolution, when it maybe comes to speaking to a difficult client, or somebody who for some reason is being very defensive, or they've got the backup, and when they're talking to you, or even listening to somebody, and you're there for them because they're struggling with something, they're really stressed, or they're struggling mentally, and so you want to be a good friend, and you offer yourselves as a listening ear. And we talk about being non-judgmental. One of the easiest ways to not be judgmental when you're listening to somebody is to try and understand it from their point of view. All right, because it's not about your values and how you see life, it's about them and how they see life. And you might not agree with it, you know, you could be completely, totally against what they're saying. In that moment, there and then, it's not the time to say anything. And if you're going to challenge them, well, there's no point you saying that you're going to be there for them, you know, because it's not the time. And we look at conflict resolutions, and usually within conflict resolutions, it comes down to effective communication. Yeah, not just communication, effective communication, and owning your part of the communication. If you're the instigator in the communication, so if I start a conversation and it's very much like this, how do I expect people to react when I'm like that? Yeah, so it comes down to me, and I have to accept responsibility for that, take responsibility of that, take ownership of that, and how whatever communication comes back to me when I've been like this at somebody, that's on me. It's not on them, because I instigated it. All right, and so how we perceive life, and understanding that we all perceive life differently, and we all have our own expectations. Who's gone to a movie, and you've had an expectation of the movie? You watch the movie, you can't go, oh geez, that was rubbish, man. You're really disappointed, that feeling of disappointment. It's because you built your expectations up too much. Now, put it in a business sense. If you're going to go into a networking meeting, you've paid out, or you've paid to watch someone speak, you know, or you've paid to go to a retreat, and then afterwards it totally wasn't what you thought it was going to be. You didn't get as much value from it, or whatever. You've got to look at your expectations, and was it that you don't feel like you got out of it what you should have done because your expectations were up here, and there was no way they were ever going to be met. So understanding our own expectations, our expectations of people, of situations, of life, our expectations of ourselves. You know, we usually have such high expectations of ourselves, and we put so much pressure on us that actually we're inviting problems in, and we're inviting self-doubt, and then we lose self-confidence. And then our level of self-worth decreases, and you know, you're on a slippery slope from then. So there's a lot to be said of being self-aware of who you are as an individual. And let's look at depression. Now, I'm not a great one for stats, however, they do have their place. All right. So statistically, when you look at depression, roughly 70 to 75% of people with depression, they can trace it back to the reasons, what caused it in the first place. And the three reasons typically are due to not having a lack of meaning, identity, and purpose. So those three are typically deep-seated within poor mental health and the reasons for it leading on to depression. So especially when you're talking about veterans transitioning from the military into society, we lose our meaning, identity, and our purpose very quickly. as soon as the gates close. Doesn't usually hit us for a couple of years, year to 2 year. On average, it's around about the 2 year point when, as individuals, we start questioning, who am I as a person? I'm not here to stack shelves. That's not what I was about. 15 years in the army, 20 years in the Navy, 30 years in the RAF, whatever. And now I'm stacking shelves. That's not my purpose. That's not what I'm meant to be doing in this world. So what are you meant to be doing in this world? Where is your place? And a lot of the time you'll find that it's deep-seated within your passion, whatever your passion is. And usually when you talk about going into business is trying to find a way of monetizing your passion, because when you do that, then it's not like working. However, that's so much easier said than actually achieved. So be honest with yourselves. It's too easy to lie to ourselves. Try to be honest with ourselves, accept the truth, and work on being aware of who you are. This also helps with leadership skills, management skills, and obviously, as I'm saying, about you. So then after self-awareness, we're then going to be looking at self-care. Okay, so self-care. Yeah, sounds a bit obvious, isn't it, about how to take care of ourselves. All right, but what does that look like? And this is the point. What does self-care look like to you? Now, mental health is individual. We're all wonderful, unique individuals, and because of that, and because mental health is individual, then actually what self-care is very deeply personal and individual to us all, as individuals. So trying to copy someone else's self-care regime, if you like, simply won't work. Certain elements, areas of it might, but as a whole, you really need to identify what works for you specifically. And then you can break it down even more and go, how do you take care of yourself within certain situations? You can really focus in and be very specific. So for example, when I begin getting panic attacks, I know what are tools and techniques work specifically for me to be able to calm myself down and to minimize the feelings of anxiety, minimize the symptoms that I gain through having a panic attack, and will ultimately prevent me going from hospital, because it's happened on 2 occasions now. So it's really important for me as an individual to be able to understand specifically how I can manage, how I can identify that a panic attack is about to happen, or my anxieties are building up, and as I'm getting pains on my chest, as I'm starting to sweat more, as I'm feeling more and more anxious, I know that if this continues on, I'm going to have a panic attack and it's going to be pretty severe. So I've learnt that, I've identified that, and so I know now at what level I can just suck it up and carry on. So presenting can be a big one. Talking to a camera and no faces behind it has been extremely weird and difficult for me, and sometimes I still struggle with that, which is why you kind of get me going and quite a lot. So that's a new word for me now. So I've been using that. So how often, at what point can I continue facing my fear and not give in to it? And at what point do I need to go, actually, I need to stop now. I need to do something, because otherwise, if I don't, then this is going to get out of control, and the worst case scenario is going to happen, which is ultimately for me, I'm going to end up in hospital. And hospitals are busy enough at the moment without ambulance coming out to get me or whatever, because I'm having a panic attack. So it's very much on me as an individual. And so, that is really, really important. And taking ownership, accepting responsibility and taking ownership of our own well-being, that is totally on us as individuals now. And I was saying this prior pre-COVID, and I'm absolutely banging the drum now, even more, stating that we really, really have to take responsibility, accept responsibility, and take ownership of our own well-being as a whole, physically and mentally, but definitely within mental health. It's the only way that we're going to prevent an all-out mental health crisis from happening in this country, because it's like a tsunami wave. It's growing momentum, and the wave's getting bigger and bigger. And if we don't start doing something about it, and if the government don't start getting involved and start funding local community support groups and organisations to really get in at community level to support these individuals, then, you know, I dread to think where we're going to be at by the end of the year and going into 2021. So it begins with you. That's what I'm ultimately saying. It begins with you. It begins with me. It begins with all of us as individuals to identify our own well-being, and what we need to do, you know, because it is on us. It's our well-being. We should be bloody taking care of it. So within self-care, identifying what stresses you have, or as a whole, you know, and by the word stresses, I mean, what negative things have you got going on, or what negative thoughts have you got going on? Is do you have to take the dog to the vets? Is the car broken? Is the washing machine broken down? Does your partner snore? Are you worried about your house, your job, money? All these kind of things, yeah, they're called stresses. So, and we all have containers, and some people have huge containers like this, which stresses go into, and all these stresses build up, you know, but it takes a long time for the container to fill up because it's so big. And then other people have itty bitty tiny containers, and stresses go into there, and it very quickly overflows because it's so small. All right, and you can probably relate and identify with people like that within your life, socially, within work times. You know, the smallest thing seems to set them off. It's called emotional snapping. Whereas other people are like horizontal, you know, water off a duck's back. Yeah, be fine. You know, don't worry about it. It's all right. And that's because we've got different size containers. It comes down to resiliency, and it's all things that we can do something about. We can change this. We can change our mindsets. We can change how we view life. We can change how we view situations. We can prevent ourselves from viewing everything in such a negative way, and have a baseline of positivity. How awesome would that be? And that's not dismissing the fact that crap happens in life, because it does, you know. However, it's having a baseline of positivity, of a positive outlook in life, and when the brown stuff does hit the fan, that actually we have a certain amount of tools, techniques and coping strategies and things like that already in place, so that we can manage it when we have those low days, or as I say, when the demons of darkness come round to visit us. Now, when we're looking at our stresses, what we want to be looking at is, will we manage them? How will we manage them, and when will we manage them? Okay, so will, how, when. Really important things, because some people understand all the problems they've got in their life, but they never do anything about it. And if you kind of go, yeah, I'm going to sort that out, put a date to it. Tell somebody that you're going to do this by that time, because then you've got this accountability, which there's when you're held accountable for something and someone else knows you're meant to do something by a certain date, we are more driven to do it, rather than if it's just ourselves, because then we only have to lie to ourselves, you know. And how often do you lie to yourself? Be honest. Can you? So identifying will, how, when you manage the stresses, and then identifying what impact each stressor has. You know, does it trigger a panic attack, for example, for me? You know, or is there a number of stresses that build up to a panic attack? And it's then looking at each stressor in turn, and there's an exercise that we can do around this based on looking at each stressor, taking each one in turn and going, are there any facts around this? What can I control it? If I can't control it, then what do I need to accept and drive within myself? If I can control and manage it, what do I need to do? When am I going to do about it? And how am I going to do it? All right. So, and then it's all about, what do you need to do on a day-to-day basis to take care of yourself? Do you need to go on a walk? Do you need to do some journaling in the morning and at night? Do you need to do some guided meditation? Do you need to do going for a walk, take some photographs? What does your self-care plan or your care plan, as within the social care services, I've got a care plan for my social care, and I know what each organisation, each department is meant to be doing, and that is my care plan. So what is your care plan? So let's look at self-help then, lastly. With self-help, pretty obvious, I suppose, isn't it? It's about helping yourself. A little bit more complicated than that, though. So with self-help, what you want to be looking at doing is, it's a bit like insurance, all right? I'll use an analogy of having insurance. If you don't have any house insurance and your house gets broken into and all your items, belongings get stolen, your TV, your PC, your laptop, etc., you then go into the if only I had, if only I had insurance. And that's a bit like with self-help, because when you may be sitting watching this going, I've never had any problems with mental ill health, I'm absolutely fine, and yeah, they're tough times at the moment, but I'm managing it. Brilliant. I'm really glad that actually you're like that. Problem being, there's millions and millions of people who aren't like that, and also you never ever know when you're gonna suddenly begin struggling with your mental ill health, especially with all the uncertainties we've got right now. And that's why it's like the insurance. You can never sit there and say you're never 100% going to be robbed. So, and especially when it comes to your mental health and poor mental health, you can never 100% say that you're not going to struggle with mental ill health or mental illness. So therefore, identifying what you can put into place, what tools, techniques, coping strategies, what things you can put into place for your self-help prior to anything happening, that time spent will be invaluable. And I explain a little bit why now. Firstly, acceptance and asking for help. Going through the process of accepting that it's okay to ask for help, that you're not weak asking for help, just like it's not weak talking about your emotions and talking about mental health. Going through the process of accepting that whilst you're still in a good place and whilst you're managing things is going to be invaluable for you. Trust me, it's taken me a long time for me to be able to accept that it's not a bad thing asking for help, and that actually you're creating more damage. You'll be a weaker person should you not ask for help and gain the support of people. When you're in the military, if you're pinned down in a firefight and you're struggling, you call up support, you call up backup, and you get people in to be able to help you to win the firefight. And it's exactly the same kind of thing. When you're struggling as an individual, call up support, call for backup. And that's all you're doing. So going through that process, because you don't want to be in a bad place, your self-care hasn't worked, you're still declining, you're in consistent low days,
possibly even fighting the demons of darkness, as I call them, or God forbid you're struggling in a crisis, then trying to accept that, to then go through trying to accept that it's okay to ask for help. It's a really bad time to do it. So go through that process first for acceptance, and that it's okay to ask for help. And then the second thing what you want to be doing is identifying who you can turn to and who you can ask for help. Now, not to put people into categories or labels or anything like that, but typically you have two types of people. You've got Ivan, who I would turn to Ivan to generally chat shit, get stuff off my chest, have a bitch and a moan or whatever, and that's the kind of person, that's what Ivan's there for. Pull up a sandbag and just have a moan. I wouldn't turn to Ivan about anything really personal and about relationship problems and stuff like that. Not the kind of guy that I'll go to. Irene, great names these, aren't they? Irene, Irene's the person that I would go to if I've got something, deep set, something really personal, and I really wouldn't be comfortable speaking to anyone else. I'll go to Irene. So, typically they're the kind of people that we have. It took me a long time, especially with the military, where, everyone's there for one another, to then come out and go into society where, because you've got a friendship with someone, doesn't automatically mean they're there for you blanket for everything. Because they've got their own shit going on. They've got, there's too many variables. They've got their own family. They've got their own lives. They've got all this kind of stuff. And it's a completely different mindset. It's a completely different way of life, culture, and a whole load of stuff. So it's taken me a long time to learn this. But yeah, so we've got, there's friends, different friends are there for different reasons. And it's identifying who's there for what, but doing that when you're in the right place to be able to do that. And then from there, it's which coping mechanisms do you need to employ and when do you need to employ them? I spoke about before in self-care about panic attacks and identifying when I need to actually start acting rather than being kind of, no, I'm just going to face my fears. It's not taking control of me. No, I'm not going to do it. I'm going to carry on, and then actually identifying, yeah, no, I can't beat it this time. And so I actually need to do something about this now, and I need to interact. And it's exactly the same with self-help. Identifying when this is getting too much. If I don't do something soon, this is going to go south really, really quickly. And what coping mechanisms, strategies, whatever terminology you want to use, what works in what situations. So I've identified when I'm in a lot of pain, I now have set things that I do. I've got set coping strategies, coping mechanisms that I put into place when I'm in a lot of pain. And again, when I'm in a lot of pain, that can really impact my mental health, and it can trigger all kinds of stuff. So I need to do it, because otherwise I could be very quickly the demons can take control, and before I know it, it's 3-4 days later, and I'm having suicidal thoughts. So it's not so much like that anymore, because I've identified all this kind of stuff. Sometimes I can't, or can't 100% manage it all the time. It doesn't work that way. Human beings, we're not robots. So how bad is it? I got three levels. I've got low, demon, crisis. So low mood, demons of darkness as I call them, and then I have the crisis level. And it's really important to identify whereabouts you are within that. And then identifying about whether you can manage where you are at right now. And this is the time to be honest with yourself. All right, you really need to be able to be honest with yourself right now. A low mood, for example, I can manage a low mood. Demons of darkness, a day or two, I can manage them by myself. That's not too bad. goes up to 3, 4, 5 days, then I need to be speaking to somebody before it gets to crisis. And this is stuff that I've learnt, and this is why it's so important. And when you do actually ask someone for help, to be able to relay whereabouts you are and what you can and can't manage, and to be able to give them as much information like this as possible, that really enables the organization, those that you're turning to help. It really empowers and enables them to be able to support you a lot quicker when you give them all the information. All right, so that. Identifying what point you need to ask for help, which is, as I say, it comes kind of between identifying how bad it is and how much can you manage, and at what point do you actually ask for help. More importantly, not more importantly, but really at the heart of for self-help is identifying what local support you have within your region. And that's all the way. It's great that we've got Mind as a national organisation, for example. It's great that we've got Samaritans. It's great that we've got Shout, which is a text service. So you text Shout to the number, and then you text, talk to someone via text. So it's great that we got these kind of things, and all the others, the big organisations that are out there. But the small local support groups that you'll find in each pockets of towns, cities, and villages around the country, they are invaluable. I cannot stress, if that's the right word, but I cannot really highlight enough how invaluable the local support groups are. Typically they've got a Facebook page. They're less likely to have a website, so you might have to go onto Facebook and search around your local area. I live in Toaster, and I've set up a men's support group, for example, and that's starting to build up already with people. It's because it's not a professional service. It's a lot easier for people to be able to take that step to come to a local support group, and also because the individuals are local. Ringing a stranger up and going through all the forms that they have to go through because they've got safeguarding policies and procedures that they have to go through. That's there for one reason, but actually going to a local support group with people from your area, it just makes you feel so much more at ease and more comfortable and more relaxed, So identify what local support you have in your local area, what support groups, what kind of social enterprise organisations have you got. Again, identify that before you actually need them. And maybe pop down for a coffee to one of them before you need them, just to go down there, show your face, because then you'll meet people who understand and can empathise, and they might actually turn out to be the people that you turn to for help. Okay, so it's all about that socializing and having a social support network, having people who understand around you, having positive people around you. It's all that kind of really great stuff that helps you. Well, there you go. I hope you enjoyed this session, and I hope you gained a lot of value out of it, as much as the attendees on the day did. We've received nothing but great feedback from people ever since the day session was held. Should you have any questions whatsoever, please feel free to reach out to me on nick@talkmentalhealth.org.uk. As ever, take care of those around you, but please, in these more challenging times, take care of yourselves. Bye for now.